Hello class, my name is Amber Gagliotti, and this week I'm going to talk to you about the drug effects on pregnancy. Any drug can affect an unborn child. This includes prescribed drugs by a doctor or illicit drugs such as marijuana, cocaine, alcohol, things like that. Every drug can affect a child in a different way. Some drugs are stronger than others. For example, marijuana is a drug that has a less strong effect on the fetus. Marijuana is a drug that affects the child just as tobacco would. Marijuana deprives the child of oxygen, which can in turn create a higher chance for miscarriage, low birth rate, early birth, things like that. Some drugs that have a higher tolerance on the baby or higher effect on the baby is cocaine. Cocaine is a drug that affects the baby straight through the placenta. The placenta is the outer wall that protects the child. The placenta provides the baby with oxygen, with nutrients. Cocaine attacks the baby through the placenta and then enters the baby's circulation. Traces of cocaine can be found in the baby's umbilical cord, in their hair, and any bywaste, like the products that they produce while inside the womb. Other drugs that have a high effect on the child are methamphetamine, heroin, things like that. These drugs are highly addictive as well. Not only does the mother become addicted to it, but the unborn child also becomes addicted to it. This means that when they are born, they also come through a withdrawal, just like the mother. Withdrawal symptoms for babies include abnormal sleep habits, problems feeding, things like that. All these drugs have a lot of the same effects. They can lead to miscarriage, they can lead to low birth weight, they can lead to developmental factors down the road. Some of them create anxiety disorders, some of them create learning disorders such as ADHD, where the children have problem focusing. They can also lead to physical disorders because of abnormal growth inside the womb. One thing that we do need to take into mind is that there are treatment for these pregnant women. You must be careful though, because a lot of the treatment that is used are things such as methadone. Methadone is also very addictive. Some of these drugs used are used to try and help the mother wean off of the drug of choice, such as heroin or methamphetamine, but in turn, the child then gets addicted to the drug that is trying to help them. Although these drugs are less harmful to the child, they are also highly addictive. Not only can these harmful drugs affect the child through withdrawal symptoms and things like that, but by parents injecting illicit drugs to their body, things such as HIV and other diseases transmitted through the IVs can be transmitted to the child as well. When a pregnant woman is being tested for drug abuse and symptoms like that, they should also be tested for HIV and any other drugs that might be passed, or any other infections that might be passed on through the drug of choice. Another thing that they must test is the development of the baby. When the baby reaches certain stages, special precautions need to be taken via ultrasounds and things like that. Based off of the drugs, the child can have various developmental issues. Some issues can be noticed early on, such as like face malformations and things like that. There may be certain things that the doctors can do early on to help prevent these different deformations amongst the babies. So it's very important that these precautions are taken to make sure that the baby develops to its fullest potential. In addition to methadone as treatment, some other treatments that have been used for pregnant women and their drug addictions are naltrexone and buprenorphine, I think that's how you pronounce it. These drugs are also addictive. It depends on the severity of the addictive disorder, the addictive behavior, the lifestyle of the individual, and what fits the individual best. Buprenorphine has been proven to be less harmful to the child and more mild versus methadone. The babies do tend to get addicted to both. However, buprenorphine has been proven to have less of a hold on the child. So when they are born, they go through a less intense withdrawal session. The withdrawal from these things include various sleep habits and different things like that. Naltrexone can be taken through injection to the mother. Buprenorphine and methadone are both drugs used to treat drug addictions that attack the baby through the placenta, just like heroin does and cocaine and things like that. So when they attack the baby straight through the wall that protects them. The effects of methadone and buprenorphine can be more harmful to the child than the mother. When they are born, they may have to be stuck in ICU for a while to try and monitor the withdrawal treatment or the withdrawal symptoms of that drug. The babies may become super irritable. They may have abnormal sleep patterns. They may have diarrhea, things like that, all different kinds of side effects. Some children will withdraw off the medicine in a week. Some children may take up to a couple months. The effects of drugs may also lead to low blood sugar, low birth rate, all types of different side effects which would keep them in ICU longer. We need to monitor before and after. It's not only the child that we must monitor and we must keep an eye on, but also the mother. For mothers, it is recommended that they do an inpatient treatment. The mothers that opt out of the inpatient treatment must be seen twice a week for 6 to 8 weeks, and they also must be seen afterwards. The postpartum depression can also lead to a relapse with drugs, so it is very important that even after the child is born and after they have made it through the withdrawal process of the illicit drugs such as methamphetamine, heroin, cocaine, that they are monitored and kept through sessions even after the child's birth. We want to be there and build the relationship with our patients to make sure that they know they have that connection with us, that anything that they experience, they can come to us and talk to us because we are there to help. We don't want them to relapse. As human service professionals, this is a very important topic for us to understand because we will be working with all different types of diverse populations and we may run into a situation like this. We need to understand different treatment methods and what best fits our clients. Just like the physician that prescribes the treatment, such as methadone or buprenorphine, we need to understand the circumstances and the lifestyle of our client. It is important to understand their addictive behavior as well as different habits that they may have. Each drug of choice has a different effect as well as the treatment. Some treatments the clients will take to better than others. It is very important that we understand how addictive these things are. Even though methadone is given to pregnant women that are addicted to drugs to help them wean off of something, they also become addicted to it in the end.